Hello, everybody. Sorry I'm a little late today. I am definitely not in my home court. So it took me a bit to try to figure out how to get on Wi-Fi where I'm at and how to get my computer up and going. And here we are. So I very much, you can see behind me, this is just a painting on the wall, but we are here in Cancun this weekend, my entire team and I. So we brought 36 people and we have been having an amazing time. Our theme at our dental practice this year is level up. And so what we are doing is we are really working hard to level up from an education standpoint. We've actually already been to numerous education meetings already this month in January. And what this meeting is, it's actually not a meeting. This is a bit of a retreat. It's leveling up personally and professionally. So today we had a kickoff meeting where we talked about designing our lives and what that looks like, and how being very intentional about your time and what you focus on, because really what you give energy to, and I am a huge believer in this, what you give energy to is what will come into creation. So that's why we're here doing that. So that's why I'm looking a little disheveled today because I've been out getting some sunshine, some sand, and all those kinds of things. But let's talk about all of your questions. What do you want to know? How can I answer some things for you? While we're waiting for questions to come in, what I want to kick off the day with is talking about elderberry. What in the world is elderberry? Well, it's funny because I actually have a couple of elderberry bushes in my yard, and these elderberry bushes, what they are is they're amazing for the immune system, for generating immune strength, for helping your immune system to be resistant to things like colds and flus that come along all the time, like right now. So this, I've always loved elderberry, and I've loved being able to strengthen the immune system naturally. So elderberry has been something that's been in my medicinal toolbox for forever. Well, now what I've done is I've actually created elderberry herbal blends. I've worked with a company actually who's created these elderberry herbal blends, and what we're doing is we're bringing these now to be able to sell to all of you, and they've been created with an herbalist. They're quite amazing. I found them first, loved them, and said I want to bring these under the brand. So we have 3 different versions. We have elderberry plus immune, which makes sense, right? So it has some additional herbs that support the strength of the elderberry. And then we have elderberry plus energy, which is amazing. So it's natural energy instead of the energy drink. It's natural, all natural herbs. It takes a little bit of a ramp up time. It's not just like, boing, you're wide awake like a shot of caffeine would, but it gives you just sustained energy, which is awesome. And the third is elderberry plus inflammation. So that one is amazing also for turning down inflammation in the body. I've been using all of them pretty much religiously for the last couple of months, and I can tell a difference. In fact, I've got a little bit of a stuffy head, and all of a sudden this morning I went, I didn't take any of my elderberry stuff. I'm going to go take it right after this. So check it out. We should have that up on the website within a day or two, and all ready for you to help during all this cold and flu season, because it's been a nasty one. There's been a lot of people who've been really sick. Okay, I see we got some questions coming through, so let's look at them. All right. Oh, that's not the way we want to show this one. Is Myobrace a good treatment for TMJ, or do I need a different appliance? I read the Myobrace will help widen things up for breathing while fixing TMJ issues. All right, let's talk a little bit about this, because this is something that I actually really talk a lot with patients about practice. So the concept is, if you have a narrow jaw, now why would you have a narrow jaw? Did you just get the bad straw, the short straw genetically? How does that happen? Well, a lot of it is actually based on growth and development, and the tongue is key in growth and development of the mouth. This is why we talk about tongue ties so much with children and infants. It's about breastfeeding and the challenges that an infant has if they have lips and tongue ties, but it's also about growth and development, because the tongue, when a baby is sucking, nursing, or a bottle, it doesn't matter what they're sucking, they use the tongue up against the roof of the mouth against that nipple or bottle. And that tongue pressure creates the sucking motion, allows the baby to eat, but it also creates pressure against that roof of the mouth and expands the roof of the mouth. So if the tongue was tied down to the floor of the mouth and couldn't get up there, and these could be even partial ties where you can get halfway up but not all the way, it will create a narrow jaw. And you end up having to mouth breathe, often hang the mouth open to get enough air. Everything narrows. Well, in this narrow jaw position, what's going on is it's straining a lot of the muscles here. That is one reason why you could have these jaw issues. There's other reasons too. Perhaps you got a blow to the chin, even learning how to walk at a year old, or, a lot of people go, oh yeah, there's this scar right here. They'd forgotten completely about it until I said, did you hit your chin ever? Oh yeah. And it damages what's the structures that are going on here in this jaw joint. It severs ligaments. It allows cartilage to come out of the joint, lots of different things. So there's a lot of different things that could be happening in a jaw problem. So when you're asking the question, what is good treatment for TMJ? It does widen the jaw. So the first question I have is, well, why, when you say TMJ, what exact symptoms are you struggling with? Are you struggling with issues with breathing? Because that's going to probably show up more as sleep apnea or sleep obstruction or poor sleep than TMJ. Or are you struggling with muscle problems and muscle tension and headaches or popping and clicking? Well, any of those may be from either growth and development issues, or they may be from an injury, or, there's a lot of different things that go into it. So the first question is always, is this a muscle problem, or is this an actual bone problem, a jaw problem in the joint? If it's a muscle problem, the Myobrace is actually going to make it worse, because it's going to give you something to chew on all night long, which is kind of an interesting thing. So you don't want to just have something in your mouth that you're gnawing on and chewing on all the time, because that's going to fatigue the muscles even more. What Myobrace is it's actually a removable appliance that you wear, and it helps to reshape the jaw. Does it work? Yeah, it does, but it requires a lot of use. You have to have it in your mouth quite a bit, during all your nighttime sleeping, but plus even some hours during the daytime. So can it work? It can. But if your problem is actually muscle issues with jaw joint because of the teeth position, because of some growth and development issues, it's actually not going to help. So start there first. What's the actual issue with your jaw? Is it the muscle problem? Is it the actual joint problem? That's where you're going to start. Then you'll be able to answer better, is Myobrace an actual and effective treatment for you or not? I typically don't use Myobrace for jaw problems. There are some other appliances we use that are fabricated very specifically for you. They're custom made, because Myobrace is not custom to you. It's a one size fits all kind of thing. And we make very custom appliances that are designed to relax the muscles and let the joint heal. So again, what's the problem? Start there. What causes more plaque than normal, and how to address it? So plaque is actually the accumulation of bacteria in something called biofilm. Biofilm is the thing that lines. Have you ever washed your water bottle and you're washing it? You're like, what's this kind of scummy stuff on the inside? You're trying to reach way down in there and clean it. That's biofilm. It's bacteria that often through a liquid get into kind of this filmy stuff. It's a whole bunch of aggregation. It's usually like the bacterial byproducts is dead bacteria. And it just creates this kind of gummy, sticky thing on the inside of the water bottle, on the outside of your teeth, on all these places. So the plaque will stick in that biofilm. Why would you have more biofilm, which would then equal more plaque? Well, it's usually because you have more bacteria. So what you can do is work to balance that bacteria. I'm actually working on a product right now that's going to do just that. But in the meantime, oil pulling is a fabulous way to balance the bacteria. What you do is you put a tablespoon of oil in the mouth, you swish it around all through the teeth for about 10 minutes, then spit it into a Kleenex, not into your sink unless you want a clogged sink. It actually does work to help balance the bacteria. There's other things you can do too. My mouthwash actually is amazing for this, because it has colloidal silver, which is basically it kills bugs as well. So you're just wanting to balance the bacteria. Give that a try. Often you'll see the plaque go down. Now, if you're asking about tartar, the hard stuff, that's really hard to get off the teeth. If you're getting a lot of tartar, that's usually because of a calcium metabolism issue. So you need to increase vitamin D3 and especially vitamin K2. That is a biggie. I just learned this actually at a course a couple of weeks ago. You need exponentially more than even I've been recommending. So about 15 milligrams a day, which is a lot of vitamin K2, that helps you to metabolize calcium properly. So if it's tartar you're talking about, vitamin D, vitamin K2. If it's plaque, the sticky stuff, it's oil pulling and mouthwash. All right. Thank you for wishing the trip is amazing. It has been so far. Do you have to get back missing top and bottom molars? 31, 32, 2. So what she's talking about, tooth number 31 and 2 are actually first molar. Well, no, they're second molars, but they're not wisdom teeth. 32 is a wisdom tooth. Do we have to get them filled with an implant to correct a bite and not get TMJ, where a TMJ appliance told that they aren't necessary, but now finding that you're having TMJ issues. All right, so here's the problem. If you're missing very back teeth, if you think about a nutcracker, so a nutcracker, the the place that you're going to get the most pressure is right here in that hinge point, right? If you're going to put the nut way back in here in the hinge point, then you're going to get the most pressure. Well, if you think about this jaw joint, it's kind of like a nutcracker. You know, we're chewing food and we're chewing through things. The most pressure is going to be closest to the hinge point, which is the very back teeth. If you do not have those very back teeth, it puts a lot of pressure on the teeth in front of them. Not only that, but it actually sometimes allows to what we call overclose, where you don't stop. You know, you're hinging closed here, but you don't have the tooth to stop it, so you actually almost close a little further, which overstretches the muscles and can lead to jaw joint pain. So do you need them? Well, in your case, 31 and 2, you may want to replace. We oftentimes tell people you're okay without it, and you may be, but you're experiencing that maybe you're not. So that, again, would be something into looking into getting those replaced. You've ever had patients that have issues with ceramic implants, or are they good for anyone? I have never had a patient with an issue with the ceramic implant, never. So what we typically find is that they are very biologically accepted, meaning that the body loves them. And so the body just attaches to them, the gums attached to them, there's no inflammation around them. And it's really interesting. There's actually a lot less pain associated with any of the procedures, which is kind of fascinating. I was, again, just learning about this a couple of weeks ago. And there is likes it better. It doesn't turn on the immune response when you put in a ceramic dental implant. So pretty much everybody. Okay, liver disease or bile issues related to gum disease or an old wisdom tooth extraction is a concern of mine. I did find a dentist with a cone beam CT scan in their office and have an appointment early February. Okay, so this is something that we can talk about with meridians. So energy meridian in the body. And when I talk about energy, people are like, oh, she's kind of like that crazy person talks about energy. Well, no, actually, if your heart beats or if your brain fires, you're full of energy. So your whole body is run on energy. And when we die, death means that energy flow stops. The heart stops beating, right? The brain stops firing. We call it brain dead when the brain stops firing. Energy flow, when energy flow stops, that means death. That means the body stopped living. We have energy flow everywhere, not just through the heart and brain, but through the entire body, obviously, because we move, we're energetic. We can actually recharge. We can do all these kinds of things. And that energy flow, those energy channels have actually been mapped. And what they found is that there's places, I like to think of them as on-ramps to those energy flows, and we can actually access them, and they're connected top to bottom. So the cool thing is that each tooth is on one of those energy channels. And there's like sometimes 2 teeth to one energy channel. But what it means is that if there's a problem with a tooth in the energy channel, it will often affect the other organs in that same channel, and vice versa. If there's problems in the other organs somewhere else, it'll affect the teeth. Sometimes we'll see it show up in the teeth. So when you're talking liver and bile and gallbladder, those kinds of things, you're talking about these teeth right here, front, top, and bottom. This is where the liver meridian, the liver energy channels, the gallbladder channels are right here. So it's actually not associated largely with wisdom teeth. What is associated with wisdom teeth? Gut function. It's called the vagus nerve. That's kind of the vagus nerve teeth back there. Everything gut function related. It's also the endocrine system. So often it'll show up as thyroid or adrenal issues. So yes, is there concern about wisdom tooth areas? For sure. Can you see a cone beam CT scan? Absolutely. Is it affecting your liver or gallbladder? Probably not. But if you have a root canal up here, something going on up here, that absolutely will affect the liver and gallbladder. So great question, because it gets us to talk about some other things. All right, what are the safest materials for fillings and buildups? We use something called composite resin. It's a combination of resin and glass, and it's the gold standard, or basically standard of dentistry now. So everybody's using composite. Otherwise, the only option is either porcelain material, which you don't use that for a buildup. A buildup is something you do underneath a porcelain restoration. So you use it to build up a broken down tooth, so then you can put a crown or an onlay on top of it. So that would be the only other option other than metal. So we know we don't want metals in the mouth, so composite one to use. I cannot get my A1C level down. I've everything. Could my dental mouth care influence my glucose levels? Absolutely. So actually, in a 5.6 isn't bad. I like it 5.3. Let's talk about A1C levels. What are they even? So there's something called glycolated hemoglobin. Basically, what it is it's a test to see what were your blood sugar levels over a 30-day span, which is great, because typical blood sugar measurements, you're just measuring today. I'm measuring, what did I eat this morning? What did I eat, half an hour ago? But when we're testing HbA1c, we're testing blood levels over a month's time. So it's a much more accurate reading than just a blood sugar level or a blood sugar reading. So I would like to see that number at about 5.3. 5.6 isn't terrible, but it sounds like you're working really hard at getting that number down. What could be related in the mouth? Hugely related, hugely related. Gum disease is enormous. Let's talk about the different forms of gum disease. There's gum disease here in the gums surrounding your teeth. So any bleeding, any sore gums, any bone loss in the area it can be checked with a dentist just in their office. We do it the periodontal probing or charting, where we measure 6 places on every tooth and see, are you losing? Show up. The other thing that's going to show up is if you have any kind of infection at the end of the root, and that is also called apical periodontitis, or gum disease at the end of the root is what that means. And so any failed root canals at all are absolutely going to be gum disease. Those are clinical research shown. You can go and I can find 100 articles that are going to connect gum disease and diabetes or blood sugar levels. So these are things you need to get checked out. So go have a gum exam with your dentist and go have a cone beam CT scan and see if any of your root canals have actually failed. That's the place to start. I have done the baking soda test. Sorry, I'm trying to show it. I have done your baking soda test and I seem to have enough acid in my stomach. That's great news. It may be now that you need to rebuild the lining if you're still having gut issues. Maybe that you need to rebuild the lining. It may be that you need to do, a whole bunch of different things other than just acid, because acid's the starting point. That's where you start and then you keep rebuilding. Can titanium tooth implants be removed from the gums? They can be. The key is that they're not just in the gum. They're actually in the bone as well. And so it's a lot of work to get them out. But is it doable? 100%. We do it all the time. This is something that is a challenge, especially if they're in an area like I have a titanium implant right here myself, and I don't love that it's there. And I'm really considering having it removed, which I'm a little nervous about, honestly, because it's going to take a lot of rebuilding. But it's absolutely possible. And sometimes it's the best thing from a health standpoint to do. What would you do if you found out that you have part of a wisdom tooth root left in you for 16 and a half years? Found out Tuesday. They're recommending bone graft and removing 100%. Remove it. Exactly the right answer. Yep, because it is not healed, and you cannot heal and you cannot be healthy with that portion of the root still left in the jawbone. All right, I'm going to do one more here, and then I'm going to jump over to the Instagram questions here. What would you recommend for removing a bridge? Well, you just have to remove it. I'm guessing that's what you're asking. If you remove it, then you replace that missing tooth with a dental implant is what I'm going to recommend, a ceramic dental implant. So you remove the bridge and have a ceramic dental implant placed in where you're missing that tooth. Okay, I'm going to jump and do some of these from Instagram here for a minute, then we'll go back to that. Can I get a mammogram and a cone beam scan within a month of each other? Great question. It's all about radiation. The cone beam scan is going to be less radiation than the mammogram by far. The different parts of the body. One's down here, one's up here. What we're finding is with digital radiography of any kind that the radiation doses are much reduced. So what is I'm going to go back and take that off of there if I can. We're going to hide that baby. Oh, there we go. What you can do is use what are called tocotrienols, and they are you're going to take along with both of those scans, and then it should help mediate that. On your Gutwell, can you take it during a meal or after if you forgot it? Absolutely. It's going to work better at the beginning of one of my very favorite ways to use this, and we were just filming some of this last week. One of my very favorite ways to use it is actually in a smoothie. So it's with a meal. Just getting those herbs to the gut lining, to those cells. Really what it is it's nourishment for the actual cells themselves to regenerate and recreate. Nothing that we take, no supplements that we take heal us. All they do is they provide the building blocks for our cells to do the healing. So this provides the building blocks for your cells. Now, when there's a lot of food in there, it's going to have to kind of sift through to find the parts that it needs. So you can see that it could be beneficial to take it all by itself. So the cells just go, oh, look, that's what I need right now. Boom, let's do it. I love to take the Gutwell powder in the evening. When you just need a little bit of a snack, a little bit of a something, that's when I do the Gutwell powder. I love the taste of it. People always joke and laugh at me, but I love it. I think it's delicious. It's peach flavored, and that's what I'll often do just in the evening, all on its own. So your body doesn't have to kind of sift through and find those building blocks that it needs. I've lost all molars and can't afford implants. I don't want dentures either. Options. this point, you really don't have options because, well, you do have options. You could do nothing, which is what you're doing. That's always an option. And that's what I tell people all the time, doing nothing is an option. But the only way to replace a tooth is either with something fixed, which is going to be a dental implant, or with something removable, which is a denture. And it's not a full denture. It's called a partial denture, where it hooks onto the teeth in front, snaps in, and replaces the missing teeth. Now, people don't love them. They're not the favorite thing in their whole life, but they're better than no teeth. So I wouldn't just totally discount that option of a partial denture. We can do all metal-free versions. There's a lot of different options anymore with removable partial dentures. Not sure if we talked about this yet, but what is the difference between a root canal and an implant? If you have nerve pain, will an implant fix it? Great question. All right, so what a root canal is if the tooth itself is dead or dying, then the nerve has been impacted. So the nerve itself is dying, and that will often cause pain. So if you have nerve pain, but we're going to go back to the nerve pain piece because it's actually a little separate from that. So if the tooth is hurting, if you have a toothache, what a root treated or a root canal tooth means is that they just remove the nerve on the inside of the tooth, fill it up with a plastic-like material, and that's a root canal. Now, the tooth stays in the mouth. I've talked extensively about the challenges with this because the tooth isn't completely clean. Bacteria find it, reinfects it, all sorts of issues systemically, like whole body issues can happen because of those root canals that have new infection at the end of them. So I don't love root canals, but that's what a root canal is. Now, what is a dental implant? It's when you remove the whole tooth, root and all. So with the part you see is the crown, but the part you don't see underneath the bone is the root. The whole tooth comes out. You lose the whole thing. Then you place a dental implant, which is the root replacement. So it goes into the bone. It looks like a screw, and it's a root replacement. And then we can connect the crown or the chewing or smiling part onto the top of that. So very different procedures. Root canal is keeping the tooth in the mouth. Implant is removing the tooth and replacing it. Now, if you have nerve pain, if it's tooth pain, I just have a bad toothache, then it may be that that's what you're looking at, removing the tooth, placing a dental implant. But nerve pain can also be from a lot of other head and neck issues. Be from so many other things going on in the head and neck. So you have to make sure this isn't a jaw joint problem. This isn't a neck issue. Where do you start? Cone beam CT scan. For one of the things you can do too is you can feed your nerves. You need a lot of omega fatty acids. There's omega 3, 6, 9, 7, a whole bunch of different ones. You need a whole bunch of them, 6 to 8 grams a day. And all of the nerves have something called a myelin sheath, which is basically like a fatty outside layer all the way around them. So if you don't have enough of those good fats, you actually can't build that insulation on the outside of all your nerves. And then you get a lot of nerve sensation. So if you have nerve pain, the first thing I have people do is start upping those omega fatty acids. You can't rebuild nerves unless you have the fats, which are the building blocks to be able to build them. So again, it's just what are the building blocks necessary to make your cells work right? This is what my book is all about, by the way. Let me give you a short little in the middle here, commercial break. I just spoke with my book agent this morning. I am so excited and so nervous. I had a dream this week that she pitched this book. I wrote a 50-page book proposal and a huge marketing deck talking all about how all of you are going to buy this book. And we sent it to publishers. And so it's the quiet before the storm right now. She said next week she starts asking them, okay, who's coming to the table? Who's interested in purchasing this book and helping her to get this published? But the book is all about energy. It's all about cells and how do we heal cells and how do we make our bodies healthy because we're getting every cell to work. So coming soon, I will keep you updated. End of commercial break. Let's get back to the questions. So it's all about energy. You have to just provide your body with what it needs to be able to heal and be healthy. All right. Can implants change the shape of your face? Well, that's a really interesting question. An implant isn't that big. So if you imagine the size of your tooth root, that's the size of a dental implant. So it's not the implant itself that would really change the shape of the face. It would be the bone that to hold the implant in place. So let's say that I do lose this implant right here. I have very little bone up here above it. So what's going to happen if I do replace that implant? I have to do a massive bone graft up in here first to rebuild the area. Now, if I had a sunken in area here at the top of my nose because I'm missing bone, then it would change the shape of my face slightly. So does that make sense? It's more the supporting structure here than the implant itself, because there has to be bone surrounding. So imagine, you have a piece of wood or a piece of bone that looks like this, and then the implant goes in to that bone. So you have to have enough bone here to be able to be on both sides of the dental implant. So it's the bone that really creates that structure in the face. My husband recently had a dental appointment. They said he has 2 cavities. He thinks it's because of not using fluoride toothpaste. That's not right, correct? Is there anything else he can do? Oh, thank you for asking this question. So when a tooth is a cavity, what happened is that the minerals got pulled out of that tooth, leaving a hole, and then bacteria crawled in. That's all a cavity is. So the problem is the minerals. Now, fluoride is a mineral that can strengthen the tooth and make it more resistant to the acid dissolving the minerals. However, that wasn't actually naturally in your tooth to begin with. Your tooth naturally is made of something called hydroxyapatite, which is a calcium phosphate combination, and that's what was pulled out of the tooth. So guess what? You don't need the fluoride, because fluoride causes all sorts of havoc in the rest of your body. All you need is the hydroxyapatite, which is what the tooth was made of. So go check out my website. Again, commercial break, but it's just because I really believe in this stuff and I created this for you. Go check it out. There's tooth powders there. There's a remineralizing one, which puts minerals back in. There's whitening plus remineralizing, which puts minerals back in, plus whitens the tooth. There's another one that's for sensitive teeth, and another one that's citrus flavored that kids love. So go check them out, because you do not need fluoride toothpaste. You just need hydroxyapatite. You need something to be able to strengthen the teeth and put more minerals in. I was wondering why my 5 and 12 gums were red. Could it be a sinus infection related? So 5 and 12, if you don't know, are right here. This is 5 and this is 12 on these 2 sides right there. So if the gums are red, could it be sinus infection related? It could be. However, more likely it's gum infection related. So you need to look and see what's going on in those teeth. Do they have old fillings? Do they have old crowns? Do they have old root canals? Because those are more likely the cause of gum redness, more local. Sinus, we're going to feel pressure. We're going to feel pain. We're going to feel a lot of stuff if there's sinus issues, especially if it's a failed root canal here. But you're typically not going to see, well, you would see gum, you would see red gums as well if it's a failed root canal. Now I have really red cheeks because I've been doing that. But you would see gums that are red if it's failed root canal. However, just the sinus infection alone won't usually lead to red gums. So red gums are an indication that something's wrong with the tooth itself. I have 2 necrotic front teeth after wearing dental retainers that were too tight. I'm so sorry. Now my dentist is recommending root canals. Do you recommend implants in this case? So necrotic is basically the word for dead. So that means their 2 front teeth died due to retainers, probably too much pressure on the tooth. Who knows exactly what happened? It may have been an injury some point in the past. It doesn't really matter at this point. But the 2 options moving forward are either a root canal or remove the teeth and replace them with dental implants. I will tell you that front teeth are the ones that are most frequently okay for a while because they're single rooted. So there's only 1 root, whereas back teeth have 3 and 4 and 5 roots. And so it's really difficult to clean them. However, I find failed front teeth root canals nearly every single day in my practice. So will you be doing an implant somewhere down the road? Probably. And the question always is, how is that impacting your health during that time that you have the tooth still in there, has a root canal, tooth still there? How is it impacting your health that is infected or getting infected? What is that doing to your immune system and everything else? Remember, this is kidney, gallbladder, liver right here. So you're going to probably have some symptoms showing up in that realm. Is it worth it just to have them removed and dental implants placed? The dentist will tell you you're insane if you go back and tell them this, but guess what? It's your mouth and it's your teeth. If that's the choice that you want to make, then do it. That's the choice that I would make because I see what it does down the road. That's a hard one. What causes receding gums? So many things, but let's talk about some different things. Be from gum infection. We've already talked about that. If the gums are actually infected, if there's bacteria and plaque and tartar up underneath the gums, then the gums will pull away because they don't like all that crud. They're trying to hook to the teeth and it's all, there's a lot of things that are making the gums really unhappy. It also could be from systemic issues. So if you have diabetes, if you have heart disease, some of these things can directly relate to gum health. So we have to get on top of all of the above. But a big one that people don't realize is it's actually from the way the teeth hit together. So if your teeth are hitting like this and you are rocking them because you have airway issues, you're not sleeping very good, you're bringing your bottom jaw forward to get more air, you're flattening your teeth, you're rocking the teeth. And what happens is the rocking point is right here at the gum line. So the gum moves up to get out of the motion, out of the place where that rocking is happening. So the gum will recede. If the bite's off and things aren't fitting very well, it will do the same thing. So you need to look at bite issues. If it's not infection in the gum, you need to look at bite issues next. Recommendations for terrible sensitivity after silver fillings removed. I'm sorry, that's so frustrating because you were doing what you wanted to do to get your silver fillings out, and now they're really sensitive. So absolutely, the sensitive tooth powder is going to be a real strong recommendation. The other one I would recommend is ozone. So if you went to a dentist that has ozone, you can use ozone gas, and it will knock that sensitivity away almost immediately. Check the bite as well. If the filling is hitting too hard, it will make it very sensitive. So those are 3 deals you can try: sensitive tooth powder, ozone, and make sure that the bite is correct. You're not hitting it too hard. Can we grow teeth back? Oh, I wish. Believe me, I would be the first one teaching this if we could. Cannot grow teeth back currently. Maybe someday in the future we're going to be able to. I'm taking 3 implants out and planting a bone graft. What is the best approach for bone grafting? I've been advised to use a combination of bone transplant and artificial bone. You know, it's interesting because I'm actually right on the fence on this one right now. I've been using cadaver bone, which is like a bone transplant, exclusively, and I'm right on the fence. I might be changing over into synthetic bone. There's something called tricalcium phosphate that is showing equal success without any kind of the immune response that getting a transplant causes. So right now I'm on the fence. I may be going over into that synthetic area, but you need to be careful what you're using. Tricalcium phosphate is the one that you want to look for. I have laryngopharyngeal reflex. I did your baking soda test and I don't have enough acid. Should I take your gut supplements? Absolutely. You're going to start supplementing the HCl digest along with food and supplements. You're going to find it tamps down that acid. Well, it tamps down the reflux. You're going to notice it all the way. But the first thing you're going to want to start is gut soothe. It's funny because just here in Mexico last night, I got a text from one of my team members saying, I've got heartburn times 1,000. What did I do? I ran to my room. I got the gut soothe and I said, go take this. This morning I said, how are you feeling? And she was like, what was that? Like the taste was familiar. What exactly was that? I said, it's diglycerated licorice. It's a licorice root. And she's like, oh yeah, that makes sense. She's like, I feel so much better. It's amazing. I said, it's a natural antacid basically. So what you're going to do is gut soothe to tamp down that reflux. Then you're going to start HCl digest along with every meal and supplement. And then you're going to get going on rebuilding and restoring, which is the gut health, Gutwell, or gut health, gut rebuild, and then Gutwell in a month. There's all the instructions. You don't have to remember what I just said. It's all the instructions online right there. My dentist uses an oral antibiotic after a deep cleaning. Is that necessary? Well, I'm going to give you my opinion. No, that's actually overkill, because what you're doing is you are treating the bacteria, especially in the gut, but in the entire body with an oral antibiotic. Now you can do a very low dose of antibiotic. And it's almost like the example I've used is it's like sunscreen. You know, when you go out into the sun with sunscreen on, the sun's still there, but you're just resistant to it. Well, the same thing can happen with a very low dose of an oral antibiotic. So if it's a very low dose, like under 100 milligram dosage of things, then oftentimes it can just help you resist bacteria. But if it's a full dose, regular old antibiotic, that is overkill for anything that's going on in the mouth. I much recommend instead the mouthwash. If you go on my site again, you can look up the mouthwash, the remineralizing mouthwash. You're going to hold it in your mouth rather than swish and spit. You're going to hold it for about 60 seconds before spitting. And that one's going to help immensely with just the bacteria that are going on in the mouth. Is titanium bad for our body? I have a titanium rod on my leg from a traumatic injury. This one's one that is fascinating to me. Here's the problem with titanium. There's just so much of it in our world today. We don't realize this. And I say this usually every single week that I'm on here, and I'm just keeping telling you the same things because honestly, the answers are all the same. Titanium is in the hard candy coating on Skittles and M&Ms. It's in cosmetics. It's in sunscreen. It's in paints. It's in so many different things. And then we're just getting some overload. And so it creates sensitivities in the body. Now you've had it in your leg. So here's the problem. You have all this titanium in you. You add a titanium dental implant. What's going to happen? Potentially a sensitivity because of overload, just too much. And I've seen this happen numerous times. People will say, oh, I was just fine with that titanium in my foot, my ankle. But then we put a dental implant in and I don't do titanium dental implants anymore. This was previous. But I had one lady who literally could not wear a necklace anymore as soon as we put a titanium implant in because it was just overload, too much metal. But here's the other one that's the biggie. You know, just sitting here, I'm in Mexico and I'm talking to you through Wi-Fi, my Wi-Fi, cellular frequencies that are going out. All of those frequencies are a wave. And those waves, when they pass through metal, create heat. This is why a microwave heats our food, because the waves pass through the food and make the molecules vibrate, and that heats up the food. Well, the same thing happens with titanium. So in your leg, in your mouth, wherever it is, when these waves, frequency, Wi-Fi, cellular, all of this pass through the metal, they actually heat it up 4 to 5 degrees. And we're finding that more and more titanium dental implants are failing. And this is the reason I believe that they're failing, is because of this heat generation, literally just melting away the bone. So if we can stay away from titanium, for you especially, you're never going to want a titanium dental implant because you have a big old rod of it in your leg. So that may not be an option. That rod's probably there to stay. So now you just need to minimize it in the rest of your life. Are you able to look at a CBTC scan and interpret if there's any cavitations? I'd like to avoid re-exposure, but I believe I have a cavitation. So I used to do a lot of virtual consultations. A lot of CTs people would send to me from elsewhere, and I would read them. I would do a video, and I actually am not doing that anymore. And let me tell you why. What I found is a couple of problems. Number one, so we were trying to shortcut the process when you come to our dental practice to get the dental work done. So I would read the scan. I would do everything that I can do off of the scan. We would appoint you. You would come in to get the dental work done. And our surgeon would look at you and say, well, first of all, these are backwards. Somehow when we received the scan, somebody swapped it. So I was diagnosing on the right side and the problem was on the left side. So it's a good thing he's very particular and checks ahead of time. And then also I can't see anything that's going on in your mouth. So it might be that I diagnose something here or recommend something here, and you have a massive cavity that I can't see on the CT scan because I can't see cavities very well on there. I can't see gum disease. I can see bone loss, but I can't see what your gums look like. There's just so much diagnostic information that I can't see on a scan. Cavitations, can I see that on a scan? Absolutely. So that's an easy one. We just can't see a lot of the other things. So people getting frustrated because we were then having to recommend that you need more treatment than we thought. It's going to be more money. It's more time. All these things, super frustrating. Or, gosh, we can't even do what we thought we could because of what we're seeing in the mouth today. So we were finding just a lot of frustration and a lot of things that we weren't really serving people very well doing that. So what we've said now is just come in and we'll try to expedite treatment as much as we can. So come in, get a CT scan. You can bring your CT scan. That's fine. If you want to come to our office and bring it, happy to look at it. It may not be adequate. They may not be diagnostic quality. Sometimes they're not. You think that all x-rays are the same and they're not. But we absolutely will use it if we can. But we do it in the office. The is if you're not coming to the office for treatment, then it really doesn't work very well for us to diagnose because you're going to take it to another dentist and say, this is what they recommend, this is what I want. And they're going to have a different opinion or not exactly the same thing, or they're going to be looking in your mouth and seeing something we didn't. If you're going to have it treated there, they should just diagnose there too. Anything should we do a 7-year-old who is losing teeth? A 7-year-old who's losing teeth, great. That's what we want to have happen, unless they're losing them from tooth decay. If they're losing them from tooth decay, then you need to get on the remineralizing supplements ASAP, which is going to be the remineralization tooth powder, the vitamin D and K. We have a liquid version for kiddos, and the tooth and bone formula. You can break the capsules apart and do, basically the tooth and bone is about 150. So depending on how much your 7-year-old weighs, maybe 50, maybe you use a third of what's in that capsule for their dosage. But you absolutely need to get on top of that if it is from cavities. If they're just losing it because they're losing them, this is the time they're going to be losing them. Do you have any experience with Cementoblastoma? I have one on tooth 30. I've been told by some doctors to remove and place an implant and other doctors to leave it alone. It's not causing problems. Cementoblastoma has often been, in my opinion, in response to trauma of some variety. So if you're hitting the tooth too hard, it will often create cementoblastoma. Basically what it means is the cementum or the outer layer of the tooth is growing in excess and creating this large lesion in the jaw of extra bone growth in the jaw. So it's usually because of trauma. So I would look really closely and see hard leading to that cementoblastoma. If it's not, then maybe you just leave it for now until symptoms arise, because it's not necessarily going to get worse or cause problems. So you can probably leave it for now. My nephew fell when he was a toddler and jammed his tooth into his gums. Now his permanent tooth is brown. What can they do to fix it? When he's a toddler, thankfully the tooth is going to come out eventually. So it may be that it's time for the tooth to come out now. If it's abscessed. If it's not abscessed, maybe you just leave it until the tooth naturally comes out. But those are pretty much the stories there. Who performs a CBCT scan? So a CBCT scan is going to be performed at a dental office, if it's like us, a health-based dental practice, or an oral surgeon will also typically have one of these, sometimes endodontists. So there's some different specialties in dentistry. Not a doctor, not a hospital. That's not where you're going to go. It's going to be in a dental office. It's a specific cone beam. It's called a cone beam CT scan. What is Gutwell powder? Go check it out on the website. It's my favorite supplement on the planet. I love Gutwell powder. There's Gutwell powder and Gutwell capsules. It's the same thing. Some people don't like the taste of the powder. I don't know why. Not everybody loves the same thing. I love the powder myself. I feel like it gets in a little bit better than just the capsules, but there's the capsule version also. I have an upper partial. Part of my concern is bone loss in my jaw if I don't do implants. This is absolutely a valid concern. The implant or the bone stays there if it has a job to do. And the job to do is to hold the tooth in. So once the tooth comes out, the bone doesn't have a job and the bone goes away. So you will lose bone if you don't have a dental implant. It is what it is. You can have an upper partial denture that can replace the teeth, but it doesn't hold the bone in place. Typically, you're going to lose the large majority of bone, about 80% of the bone within the first year after the tooth has been lost. So if it's been out for a long time, you've probably lost all the bone you're going to lose, which is probably a fairly significant amount. So at this point, doing dental implants, you would probably have to do some bone regeneration to make that happen. What would your advice be for a child who had basically a root canal done on her back molar and then a zirconia crown put over it? This was done maybe a year and a half ago. If there's an abscess above it, if there's not a tooth next to it, so I feel like pulling the crown molar isn't an option. What do we do? Great question. So if it's a child, so what it sounds like is that what's called a pulpotomy done on a baby tooth, a zirconia crown placed over it. Sounds like there's not a tooth next to it. Either they lost it early or haven't gotten the tooth yet. If there's an abscess, it needs to come out. Basically, that's the answer. And there are ways to hold that space, or there are ways to deal with the space later, because what's going to happen is they come in are going to move into the space. They're going to move into that space, and it's going to cause. There are appliances. There's one called a shoe, which has a space that goes into the gum and where it belongs. Options we deal with these. This is the key. You really. All right, I'm going to jump back over to these real quickly. I'm going to come grab a couple of those. I noticed the settlement in the bottom of the mouthwash. Are we supposed to shake it? Yes. It said I did that and it made the peppermint really strong. Yes, shake it. That gets the hydroxyapatite into all the liquid. We are supposed to have stickers on the top. Haven't been placing them. So yes, straw shouldn't. It's the same thing. Maybe the peppermints connect to all that hydroxyapatite. That hydroxyapatite and getting into the mouth. Do you do Maryland bridges after the removal of root canals on tooth number 6 or 10? So 6 and 10 is here and here, and a Maryland bridge is a bridge where there's a wing on the back of the tooth, down over the tooth. You can do a Maryland bridge, is less invasive to the other teeth after removal of root canals. 6 is going to be much more difficult. That's your eye tooth, canine. Those are all words people use, because the tooth behind it, straight up and down, the tooth of it chews side to side. They're chewing in the mouth, in the front and in the back. And what that does is puts different those two sides of the, and you're probably going to knock it off. It's going to be coming unglued, and it's a Maryland bridge. Okay, we're going to wrap up question, and then we're going to wrap up. We will, and I may be, Kathleen's on here. It might be that I just need to do another session where, so if you could maybe save, we'll even try to get to them next time. But thank you guys for all these questions. I just love them. You're asking the right things. I love that you're questioning. Different. Is there a better way? How can I do this? Please keep the questions coming. Love this. I love how involved you are. I'm 20 years younger. Happy birthday. Happy birthday, John. And last one, my front teeth are bad currently as well. Abscess was on the more painful. That was somebody I think I already talked. A sinus lift and a bridge implant 12 and 4 other root canals extract. We already can I send my cone beam? Again, if you're getting the work done, just come. Yes, let's interview. If not, go to have the person who's going to do the work. Okay, we already talked about which is should you get it pulled? Yes. What is the best way to get those for oil pull? You can use coconut oil. That's all you need. Use coconut oil and swish it through your mouth. Just regular old tablespoon. Thank you, everybody. Check out the tooth powder. Try. It has been absolutely amazing for literally hundreds of thousands of people. Give it a try. Love it. Thank you all. I'm going to go back out to the beach now, and we'll speak